Why do so many Japanese adults in their 90s wake up without joint pain, stiffness, or chronic inflammation? After a lifetime of physical work, long hours on their feet, and very little reliance on pain medication. This question comes up repeatedly when physicians and researchers study Japanese longevity and healthy aging. In clinical interviews, elderly adults in rural and urban Japan often report something that surprises Western doctors. They expect their bodies to feel usable when they wake up. Not perfect, not young, but functional. Their knees bend. Their hands move. Morning stiffness is minimal. Chronic inflammatory pain is not a daily companion. Have you ever noticed how different that expectation is from what many people accept as normal aging after 50? What makes this observation even more interesting is that it appears across income levels and generations. These individuals are not elite athletes. Many spent decades working in agriculture, fishing, manufacturing, or domestic labor. Their joints carried real mechanical load over time. Yet rates of disabling arthritis, long-term inflammatory pain, and daily analgesic use remain significantly lower than what we see in aging populations elsewhere. This is not explained by genetics alone. Large population studies have shown that when Japanese adults adopt a Western diet and lifestyle, these advantages decline within 1 or 2 generations. Joint pain, metabolic disease, and inflammatory conditions increase. That tells us something important. What we are observing is not a miracle, and it is not a genetic anomaly. It is the result of consistent daily choices, repeated quietly over decades. One of those choices shows up again and again in dietary records, household routines, and physician interviews. It is a daily drink. It is simple, ordinary, and easy to overlook. It is not marketed as a supplement. It is not consumed for pain relief. And it does not come with health claims on the label. Yet it appears with striking consistency among long-living Japanese adults who maintain mobility and comfort well into old age. This drink is not taken occasionally. It is consumed daily, often at the same time, for years. In some cases, for most of a lifetime. It fits seamlessly into the Japanese diet and does not require discipline or motivation. That is a key point in disease prevention. Habits that last are usually simple and repeatable. What you're about to discover may surprise you, because this pattern stands in contrast to how many people approach aging today. In the United States and other Western countries, joint health is often addressed reactively. Supplements are added after pain appears. Medications are used to manage symptoms. Diet changes are attempted late, inconsistently, or in extreme ways. But Japanese longevity research consistently points in the opposite direction. Prevention through daily food choices, not correction through pills. This approach aligns with what we now understand about chronic inflammation and aging. Low-grade inflammation builds slowly over time. It is shaped by what we consume every day, not what we take occasionally. Foods and drinks that stabilize blood sugar, support gut health, and reduce inflammatory signaling may not feel dramatic in the short term, but their effects compound over decades. Stay with me for a moment, because the importance of this daily drink becomes clearer when we look at how it fits into a broader pattern. It does not work alone. It is part of a small group of foods that Japanese doctors repeatedly observe in patients who age with fewer symptoms and better function. In the next section, we'll begin breaking down these 3 everyday foods, starting with the drink itself, and explain how they support joint comfort, reduce inflammation, and contribute to healthy aging without relying on supplements or extreme dietary rules. Before we go further, it's useful to pause on how understated this habit really is. In Japan, this daily drink is not discussed in terms of joint health or anti-aging. It is not consumed with the expectation of immediate benefit. Most people begin drinking it early in adulthood simply because it is part of normal meals. Over time, it becomes background nutrition rather than an intervention. That distinction matters, especially when we talk about healthy aging and disease prevention. From a medical perspective, this pattern aligns with what we see in long-term population data. The Japanese diet emphasizes consistency over intensity. Small exposures, repeated daily, shape inflammatory markers, insulin sensitivity, and gut microbiota composition in a way that short-term dietary changes cannot easily replicate. Aging after 50 is less about adding new products and more about reducing chronic stress on the body's systems, especially joints, connective tissue, and metabolic pathways. Another important point is that this drink is rarely consumed in isolation. It is part of a broader food environment that prioritizes whole ingredients, moderate portions, and minimal processing. That doesn't mean the diet is restrictive or perfect. It means it is predictable. Predictability is one of the most overlooked factors in longevity foods. When the body knows what to expect, inflammatory responses tend to remain lower over time. If you think about your own routine, how often do you consume the same foods or drinks every day? Have you noticed whether consistency helps or hurts how you feel in the morning? Many people report that stiffness, bloating, or fatigue fluctuates based on daily patterns rather than occasional indulgences. Paying attention to those patterns can be more informative than following trends. As we move forward, you'll see that this daily drink supports joint comfort not by masking pain, but by influencing upstream processes such as hydration balance, mineral intake, and inflammatory signaling. These effects are subtle, cumulative, and easy to miss if you're only looking for dramatic short-term changes. That's one reason they're often undervalued in Western approaches to aging. If this way of thinking resonates with you, you might consider noting how your own food habits have changed over time, especially as you've gotten older. Sharing those observations can be helpful for others navigating similar questions. And if you find that this kind of practical, evidence-based discussion adds clarity to your understanding of Japanese longevity and healthy aging, acknowledging that quietly can help guide future conversations like this. Next, we'll begin examining the first of the 3 everyday foods, starting with the drink itself, and look closely at what it contains, how it's used, and why its effects become more noticeable with age. The observation began quietly, without any formal hypothesis. A Japanese physician working for decades with elderly patients between the ages of 85 and 100, particularly in rural villages and coastal communities, started noticing patterns that did not appear in textbooks. These patients were not visiting clinics to complain about joint pain as often as expected. They came for routine checkups, blood pressure monitoring, minor infections, or administrative medical needs, but not for chronic musculoskeletal pain. Many of them walked into the clinic on their own, sat down without assistance, and stood up without hesitation. For patients of that age, this was not considered typical, yet it was consistently present. What stood out to this physician was that these individuals were not following special treatment plans aimed at joint health. They were not prescribed anti-inflammatory medication on a long-term basis. They were not taking supplements marketed for arthritis or mobility. In fact, many of them expressed little interest in treating aging at all. They simply continued their routines. Over time, the doctor began asking more detailed questions, not about symptoms, but about daily habits. What did they eat in the morning? What did they drink with meals? What had stayed the same for decades? This insight did not come from a laboratory experiment or a controlled trial. It came from repetition. The same answers appeared again and again across different patients who did not know each other, lived in different towns, and had worked in different professions. Their diets were not identical, but certain elements were remarkably consistent. Among these, one daily drink appeared so frequently that it became difficult to ignore. It was not prescribed. It was not recommended by the physician at the time. It simply showed up in the background of everyday life. Now I want to go deeper into this because the importance of the observation lies in how ordinary it was. The drink was consumed with meals or between meals, often prepared at home, sometimes purchased locally, and rarely discussed as a health decision. Patients did not describe it as something they took for their joints. They described it as something they had always consumed. From a medical perspective, that distinction is critical. When a behavior is maintained without conscious effort, its long-term effect is more likely to be stable. The physician began correlating this habit with physical outcomes observed during examinations. Patients who reported consuming this drink daily tended to show less joint swelling, better range of motion, and fewer signs of chronic inflammation. This was not absolute, but the pattern was strong enough to raise questions about cause and effect. Importantly, these outcomes were not linked to one-time decisions, but to consistency. The impact came from repetition over years, not from intensity or dosage. From a biological standpoint, this made sense. Joint pain and stiffness in older adults are often driven by low-grade, systemic inflammation rather than acute injury. Daily choices that reduce inflammatory load, support hydration, and contribute to mineral balance can influence how connective tissue behaves over time. These effects are gradual. They do not announce themselves quickly, which is why they are often overlooked in favor of treatments that promise immediate relief. The doctor did not frame this drink as a solution or intervention. Instead, it became a reference point for understanding prevention. Patients who maintained mobility into advanced age were not avoiding discomfort by chance. Their bodies had been exposed, day after day, to inputs that supported stability rather than stress. This aligned with broader observations in Japanese longevity research, where the absence of disease often reflects what was never allowed to accumulate in the first place. Another important aspect was accessibility. The drink was not exotic, expensive, or newly discovered. It did not require special sourcing or preparation. That made it practical for older adults living on fixed incomes and for those who had maintained the same habits since midlife. From a public health perspective, this matters. Behaviors that persist across decades are usually those that fit easily into daily life. For viewers aged 50 and older, this observation highlights a shift in focus. Instead of asking what to add when pain appears, it raises the question of what has been consistently consumed over time and how that has shaped current symptoms. Prevention is not about perfection. It is about reducing cumulative strain through ordinary decisions made repeatedly. As this explanation continues, the characteristics of this drink and its role in long-term joint comfort become clearer. Comment: this makes sense to me. The drink observed so consistently in these elderly populations is traditional Japanese green tea, most commonly sencha or bancha, prepared simply and consumed lightly throughout the day. This is not sweetened tea, not bottled tea, and not a concentrated extract. It is brewed from whole leaves, usually with warm or hot water, and consumed in small cups, often alongside meals. For many older adults in Japan, green tea is not something added later in life for health reasons. It is something they have been drinking since early adulthood, sometimes even earlier, without interruption. In practical terms, this matters because the way the tea is consumed is as important as what it contains. Elders do not drink it in large volumes at once. They sip it slowly, sometimes several times a day, often replacing sugary beverages or frequent snacking. The temperature is usually warm, which supports digestion and hydration without stressing the system. This pattern creates a steady, low-level exposure rather than a spike, which aligns closely with how the body manages inflammation and metabolic balance over time. Sencha and bancha are particularly common because they are mild, low in caffeine compared to other green teas, and well tolerated even in advanced age. Bancha, in particular, is often consumed later in the day because of its gentler profile. This makes the habit sustainable. Sustainability is a key factor when we talk about long-term effect. A daily choice that disrupts sleep, digestion, or appetite rarely lasts for decades. Green tea, prepared traditionally, tends to integrate smoothly into daily routines without noticeable side effects. Now I want to go deeper into this because the biological relevance of green tea is not abstract. It is grounded in measurable effects. Green tea contains catechins, particularly epigallocatechin gallate, or EGCG, which has been studied extensively for its anti-inflammatory properties. These compounds do not act as painkillers. Instead, They influence inflammatory signaling pathways that contribute to joint stiffness and connective tissue degradation over time. When exposure is consistent and moderate, the cumulative impact becomes meaningful. Another factor is hydration. Many older adults underestimate how mild, chronic dehydration contributes to joint discomfort. Synovial fluid, which cushions joints, depends on adequate hydration. Warm green tea contributes to fluid intake in a way that plain water sometimes does not, especially for individuals who prefer flavor and routine. Replacing dehydrating or sugary drinks with green tea reduces inflammatory stress while supporting fluid balance, which directly affects how joints feel during movement. There is also an effect on blood sugar regulation. Green tea has been shown to improve insulin sensitivity modestly when consumed regularly. Stable blood sugar levels reduce systemic inflammation, which is closely linked to joint pain and stiffness. For adults over 50, this interaction becomes increasingly relevant, as glucose regulation naturally becomes less efficient with age. Small daily decisions that smooth these fluctuations can reduce cumulative inflammatory burden. Importantly, these benefits do not appear after a few weeks. The elders observed by the physician did not describe starting green tea to fix a problem. They described never stopping. This highlights a critical point about prevention. The body responds not only to what is consumed, but to how long that exposure has been maintained. Consistency turns mild biological effects into meaningful outcomes. It is also worth noting what this habit replaces. Green tea often takes the place of sweetened beverages, excessive coffee, or frequent alcohol intake during the day. Each of those alternatives carries its own inflammatory or dehydrating effects. By choosing green tea repeatedly, individuals reduce cumulative strain without making dramatic lifestyle changes. This is how prevention works in real life, especially for aging populations. For viewers considering practical relevance, the takeaway is not complexity. It is realism. A simple drink, prepared the same way, consumed the same way, day after day, can influence how the body feels decades later. That influence is quiet, gradual, and easy to underestimate, which is why it is often overlooked in favor of more aggressive interventions. As the explanation continues, understanding how this habit interacts with other daily food choices helps clarify why its impact becomes more noticeable with age. Comment: this makes sense to me. One of the most consistent details observed among Japanese elders is not only what they drink, but how and when they drink it. Green tea is rarely consumed cold and almost never in large quantities at once. Instead, it is sipped warm, slowly, and often after meals. This pattern is not accidental. It reflects an intuitive understanding of how the body responds to temperature, timing, and volume, especially as it ages. From a physiological standpoint, warm liquids place less stress on the digestive system than very cold beverages. Cold drinks can temporarily constrict blood vessels in the stomach and slow digestive processes, which may contribute to discomfort, bloating, or delayed nutrient absorption. For older adults, whose digestive efficiency naturally declines, minimizing these stressors becomes more important. Warm green tea supports gastric activity without overstimulation, allowing digestion to proceed smoothly. Now I want to go deeper into this, because timing plays a significant role in inflammation control and metabolic stability. Drinking green tea after meals, particularly lunch, helps moderate post-meal blood sugar rises. Even modest blood sugar spikes can trigger inflammatory signaling, especially in adults over 50 who may already have reduced insulin sensitivity. Green tea compounds support glucose regulation gently, reducing the magnitude of these spikes without forcing the system into a compensatory response. This steady approach also avoids activating the nervous system unnecessarily. Large volumes of liquid consumed quickly can stimulate stress responses, especially if the beverage contains caffeine or sugar. Japanese elders tend to drink small amounts, spaced throughout the day, which keeps hydration and catechin exposure consistent without creating peaks and crashes. Consistency, rather than intensity, is what produces long-term effect. Temperature influences absorption as well. Warm tea allows the digestive tract to process fluids and bioactive compounds efficiently. This supports a calm digestive rhythm, which indirectly affects inflammation. The gut and immune system are closely linked. When digestion is smooth and predictable, immune activation remains lower, reducing background inflammatory tone that contributes to joint discomfort. Habit is the final piece. The act of drinking green tea is often tied to routine moments, such as after a meal or during a short break. These routines reduce decision fatigue and make the behavior automatic. For prevention to work, daily choices must be easy to repeat. When a habit requires motivation or willpower, it rarely persists for decades. Green tea consumption among Japanese elders persists precisely because it fits naturally into daily life. For practical relevance, especially for adults evaluating their own routines, the most realistic adjustment is substitution rather than addition. Replacing one daily sugary or artificially sweetened drink with warm green tea, particularly after lunch, reduces inflammatory load without requiring major dietary changes. Sugary beverages contribute to rapid glucose fluctuations and oxidative stress, both of which aggravate joint inflammation over time. Artificially sweetened drinks may also disrupt metabolic signaling in subtle ways. Green tea offers a neutral alternative that supports hydration and inflammatory balance simultaneously. This approach respects the body's need for stability. It does not rely on extremes, restrictions, or short-term plans. It relies on a single, repeatable decision made once per day. Over time, that decision accumulates impact. For aging adults, this kind of consistency is more protective than sporadic attempts at correction. As these patterns are examined more closely, the interaction between daily habits and long-term comfort becomes increasingly clear. Comment: I'm starting with one change. Hydration plays a central role in how joints feel and function, especially with aging. Many adults associate hydration primarily with thirst or kidney health, but its impact on joint comfort is often underestimated. Cartilage, tendons, and ligaments all depend on adequate fluid balance to maintain elasticity and shock absorption. When hydration is insufficient, these tissues become less resilient, increasing stiffness and discomfort during movement. This effect becomes more pronounced after the age of 50, when total body water naturally declines. Mild dehydration is particularly common among older adults because thirst perception weakens with age. People may not feel thirsty even when their fluid levels are already low. This creates a situation where joints are functioning in a slightly dehydrated environment for long periods of time. Over weeks and months, this contributes to reduced lubrication within joints and increased friction during daily activities. The result is stiffness that feels mechanical rather than inflammatory, yet still feeds into inflammatory processes over time. Now I want to go deeper into this because how hydration is achieved matters as much as how much fluid is consumed. Japanese elders rarely consume large volumes of liquid at once. Instead, they hydrate gradually throughout the day. This pattern supports fluid distribution without overwhelming the kidneys or diluting electrolytes. Large, infrequent intake can lead to rapid excretion, meaning much of the fluid does not remain available to tissues for long. Small, regular intake maintains a steadier internal balance. Green tea fits naturally into this pattern. It provides fluid without added sugars, which can worsen dehydration by increasing urinary output and blood sugar fluctuations. Sugary drinks also promote inflammatory signaling that counteracts the benefits of hydration. By contrast, green tea contributes to fluid intake while supporting metabolic stability. Its mild flavor encourages regular sipping, which aligns with the body's preference for steady hydration. Joint lubrication depends heavily on synovial fluid, a viscous substance that cushions joints and reduces friction. Synovial fluid is largely composed of water. When hydration is adequate, this fluid maintains its thickness and shock-absorbing properties. When hydration is low, synovial fluid becomes less effective, leading to increased wear and discomfort. This is one reason why joint stiffness is often worse in the morning or after periods of inactivity, times when hydration may be lowest. Consistent green tea consumption helps counter this pattern by providing a predictable source of fluid intake across the day. Warm tea is particularly effective because it is generally better tolerated and absorbed than very cold beverages. Older adults are more likely to sip warm drinks slowly, which supports sustained hydration rather than rapid intake followed by quick elimination. Another factor is kidney load. Aging kidneys handle fluid shifts less efficiently. Sudden large volumes of water can create stress, leading to increased urination and potential electrolyte imbalance. Japanese hydration habits emphasize moderation, allowing the kidneys to manage fluid smoothly. Green tea, consumed in small cups, supports this balance without forcing the system to compensate. From a prevention standpoint, this approach reduces cumulative stress on joints. Hydration does not repair damaged cartilage, but it creates conditions that slow further deterioration. When joints remain well lubricated, daily movements place less strain on surrounding tissues. Over years, this reduces the likelihood of chronic stiffness becoming persistent pain. For practical relevance, the key decision is not drinking more all at once, but drinking more evenly. Replacing long gaps in hydration with small, regular intake can improve how joints feel without changing total fluid volume dramatically. Green tea provides a structured way to do this because it is already embedded in routine moments. As this explanation continues, the relationship between daily hydration habits and long-term joint comfort becomes increasingly evident. Comment: This makes sense to me. Observations from Japan's longevity regions help place this habit into a broader, measurable context. Okinawa is often referenced because of its high proportion of older adults who remain mobile and independent well into advanced age. While no single food explains this outcome, green tea consumption is a consistent part of daily life across Okinawa and other long-living regions such as parts of Shizuoka, Nagano, and Kagoshima. In these areas, green tea is not treated as a health product but as a routine beverage consumed alongside meals and during breaks throughout the day. Population studies conducted in these regions have repeatedly shown lower average levels of inflammatory markers in older adults compared to populations with similar age profiles elsewhere. Markers associated with chronic low-grade inflammation tend to rise with age, contributing to joint stiffness, muscle weakness, and reduced mobility. In communities where long-term green tea consumption is common, these increases appear more gradual. This does not eliminate aging-related changes, but it reduces their intensity and functional impact. Mobility outcomes mirror these biological findings. Older adults in these regions often demonstrate better walking speed, balance, and joint range of motion. These are practical measures, not abstract indicators. They reflect how the body performs during everyday tasks such as standing, climbing steps, or carrying groceries. When researchers adjust for factors like body weight and physical activity, habitual green tea intake remains associated with these functional advantages, suggesting an independent contribution tied to daily choices maintained over time. Now I want to go deeper into this because the strength of this evidence lies in duration rather than dosage. These populations did not begin drinking green tea late in life to address symptoms. The habit was established decades earlier and maintained without interruption. This long-term effect aligns with what we understand about chronic inflammation. It is shaped slowly by repeated exposure to supportive or aggravating factors. Green tea contributes to a supportive environment when it is part of a stable routine, not when it is used sporadically. Importantly, studies do not describe dramatic or immediate changes in pain levels after introducing green tea. Instead, they describe differences in baseline function and progression. Older adults who consumed green tea consistently tended to experience a slower decline in mobility and less frequent progression from mild stiffness to persistent pain. This distinction reinforces the idea of prevention rather than treatment. The goal is not to reverse damage, but to reduce the rate at which strain accumulates. Another consistent finding is substitution. In longevity regions, green tea often replaces beverages that promote inflammation, such as sweetened drinks or excessive alcohol during the day. This replacement effect matters. Reducing inflammatory inputs can be just as important as adding supportive ones. Over time, this balance influences joint comfort and overall physical resilience. Researchers also note that green tea consumption in these regions follows traditional preparation methods. Leaves are brewed lightly, caffeine levels remain moderate, and the tea is consumed warm. These details contribute to adherence. A habit that disrupts sleep or digestion would not persist across a lifetime. Green tea's compatibility with daily rhythms helps explain why it remains part of routine into advanced age. For adults evaluating the relevance of these findings, the practical implication is straightforward. Benefits associated with green tea in longevity regions reflect consistency, not intensity. The impact emerges when the drink becomes part of everyday structure, integrated calmly into meals and breaks, rather than treated as a corrective measure. This reinforces a broader principle in healthy aging. Long-term habits shape outcomes more reliably than short-term interventions. As this explanation continues, the emphasis remains on how routine, repetition, and simplicity interact to influence inflammation and mobility over time. Comment: This makes sense to me. Applying this habit at home does not require complexity or precision. The goal is not to replicate a clinical protocol, but to create a routine that the body can accept and maintain. For most adults, especially those over 50, 1 to 3 cups of traditional green tea per day is a reasonable and well-tolerated range. This amount provides exposure to beneficial compounds without placing unnecessary demand on digestion, sleep, or the nervous system. Preparation matters. The tea should be unsweetened and brewed lightly, using warm rather than boiling water. Overly strong tea increases bitterness and caffeine content without proportionally increasing benefit. A lighter brew encourages regular consumption and reduces the likelihood of stomach discomfort or jitteriness. From a biological perspective, smaller, repeatable exposures create a steadier internal effect than occasional high doses. Now I want to go deeper into this because timing is closely linked to tolerance. Green tea contains caffeine, though less than coffee. Consuming it earlier in the day, such as with breakfast or after lunch, reduces the risk of sleep disruption. Sleep quality is directly connected to inflammation control and tissue repair. A habit that interferes with sleep undermines its own long-term effect. Japanese elders intuitively avoid this by shifting consumption earlier and reducing intake later in the day. It is also important to frame green tea as a complement, not a replacement. It works alongside a balanced diet, regular movement, and appropriate medical care. It does not replace prescribed treatments, and it does not correct advanced joint disease on its own. Its role is supportive. It contributes to prevention by shaping the internal environment in which joints function, rather than acting as a direct intervention. For individuals with sensitivity to caffeine, lower caffeine options such as bancha are often better tolerated. The guiding principle remains the same: choose a form that allows consistency without side effects. If a habit creates discomfort, it will not last. Long-term effect depends on decisions that fit comfortably into daily life. Quantity should remain modest. Drinking excessive amounts does not accelerate benefit and may increase urinary fluid loss or gastrointestinal irritation. The body responds best to balance. Small amounts, spaced naturally, support hydration and inflammatory regulation without triggering compensatory stress responses. This aligns with what is observed in longevity regions, where moderation supports adherence. Consistency matters more than strength or quantity. A lightly brewed cup consumed daily has more impact over time than a strong brew consumed irregularly. This principle applies broadly to prevention strategies. The body adapts to patterns, not exceptions. Establishing a predictable routine allows regulatory systems to stabilize and reduces cumulative strain. From a practical standpoint, the simplest approach is to anchor green tea to an existing habit, such as a meal or a midday pause. This reduces effort and increases the likelihood that the habit persists. Over weeks and months, This repetition becomes automatic, which is when preventive effects begin to accumulate. As the discussion continues, the focus remains on how small, sustainable decisions influence comfort and mobility over the long term. Comment: I'm starting with one change. When we look at the pattern as a whole, what stands out is not intensity or innovation, but restraint and repetition. Japanese elders who remain largely pain-free into their 80s and 90s do not rely on aggressive interventions or constant symptom management. Their outcomes reflect a steady accumulation of small decisions made daily, often without conscious effort. Drinking green tea is one of those decisions. It is not used as a remedy, but as a normal part of life, repeated long enough for its long-term effect to matter. From a medical perspective, this explains why the results appear subtle yet reliable. Chronic joint pain rarely develops overnight. It emerges from years of low-grade inflammation, oxidative stress, inconsistent hydration, and metabolic strain. Habits that gently counter these pressures each day help keep the internal environment stable. Green tea contributes by supporting hydration, moderating inflammatory signaling, and fitting easily into routine. Its impact comes from consistency rather than strength. Now I want to go deeper into this, because the broader lesson applies beyond any single drink. Prevention works best when it does not feel like treatment. When a habit integrates naturally into daily life, it reduces friction and increases adherence. This is especially important after 50, when the body becomes less tolerant of extremes and more responsive to stability. 1 cup of lightly brewed green tea, consumed regularly, is easier for the body to adapt to than periodic attempts at correction. The practical step is simple. Starting with 1 cup tomorrow, prepared gently and consumed earlier in the day, allows the body to respond gradually. There is no need to evaluate results immediately. Changes in joint comfort, digestion, or energy often emerge slowly as internal balance improves. Observing how the body responds over weeks rather than days aligns with how prevention actually works. This approach does not replace medical care, nor does it promise outcomes. It reflects how long-living populations reduce cumulative strain through ordinary choices. For those interested in evidence-based longevity habits drawn from Japanese preventive medicine, acknowledging these patterns can help guide everyday decisions. If this explanation clarified how small, repeatable habits influence aging, recognizing that value is enough to signal interest in continuing this type of discussion. Comment: I watched till the end. If you've stayed through this explanation, you've probably noticed that the focus here isn't on shortcuts or dramatic changes. It's on understanding how everyday habits, repeated calmly over time, shape how the body ages. That perspective is central to Japanese longevity and preventive medicine, and it's what guides the topics explored here: practical food habits, simple routines, and evidence-based ways to support healthy aging without extremes. If this way of looking at health feels useful, subscribing simply allows you to continue learning along these lines, with more clear explanations about diet, daily choices, and disease prevention as we age. And if this discussion followed your own observations or experiences, you can leave a comment with the phrase, "This made sense to me," to mark that you watched all the way through. If the information was helpful, a like is an easy way to acknowledge that value. There's also a video here that complements this topic and builds naturally from what we've discussed, so you can continue from there at your own pace.